Welcome to Monday evening's class. We're glad to have all of you here, and also very glad to have joining us Sarah Crawford from the Health and Demographics section of RFA. And I've already forgotten what RFA stands for, but Sarah will tell you all about it. This is an excellent source of data for those of us working in South Carolina, and probably unique to our state. There aren't many states, if any, who have exactly what we have here. So I'm going to turn it over to Sarah, let her introduce herself a little bit more than that, and go forward.
Hello, my name is Sarah Crawford, and I am the project manager for our state data warehouse. We have a Health and Human Services data warehouse that allows us to link agency data and health data, link individuals to do longitudinal studies and analysis, and so we have developed a process for people to request this data. So I'm going to kind of start it out. We are the Revenue and Fiscal Affairs. This was a part of the Budget and Control Board, which some of you may or may not know about, that's no longer in existence, but they pulled out some offices, and our office is, particularly our section with Health and Demographics, is really kind of focused on using that secondary data to kind of look at an individual in a whole. So basically our mission statement is, it is the entire human experience that influences health and social well-being and should therefore be captured in an integrated data system. As time has gone, we have discovered that it's a lot easier to use things like claims and the data systems that agencies have to determine things. Maybe not easier, but at least less costly. Sometimes you can't get exactly what you want, but maybe you can come pretty close. So our office is, we've got about 2/3 of our office is statisticians that are trained in statistics or disciplines similar to that, and we kind of divvy people up into groups where they become the expert in the data that they're dealing with. So we have 2 statisticians that their focus is Medicaid data. So when you have questions about Medicaid data, we can they really delve into it to try to get as much information. They have contacts at the agency so that they can answer the questions. So the evolution of the data warehouse, and so that, again, we are very unique in the nation to have a statewide data warehouse. The main things I think that really kind of allows us to exist is the fact that we are a neutral setting. Our office does not provide services. We do not pay for services. We don't regulate services. We don't do anything like that. So we are in no way competing with an agency that provides a service or pays for a service. The data that we receive that is housed at the data warehouse is still owned by the agencies. So no analysis, linkage, reporting is done on their data without them being notified. And so there's a process, which is kind of what my position handles, of requesting the data and getting the data for analysis. This is equal to all users, and we have, we say it's a state resource, but we do have researchers from all over the country that have submitted requests for data. Either they have grants. A lot of times, if we've got Harvard is doing some studies and they're doing some evaluation of projects for DHHS, Department of Health and Human Services here. We've got people who use us as a comparison state so that they can kind of get similar information to compare outcomes and results. So as long as you kind of have to go through the research process or the application process for the requests, and we submit them to the agencies and walk you through the process, and anyone can do that. And so that's the big thing, is to promote the research and use of this data. The thing is that all this information is out there, and the idea is to be able to build policy to make these changes with data with information that you know where what you're doing is making a difference. So all of the data is secured. We do get personal identifiers on individuals. That is for our purpose to link the individuals. So these systems basically exist as silos. So you have one agency here, another agency here, and even sometimes within an agency, the information may be siloed. And when it's submitting to us, we have an algorithm that we run using their identifiers to allow us to link across and to be able to track people through all their different settings. And we do have a data release that must be approved again by the data owner or a council. For instance, the hospital data has a data oversight committee that's staffed by multiple individuals that were selected by the governor to make the decisions on what information can and cannot be released. A lot of the information that allows us to house this there is a proviso and that's out there that basically states that it establishes the Health and Human Services data warehouse, and then it states that agencies will submit their information to us to allow for this holding. And there has actually been new legislation where they're actually talking about wanting to build a longitudinal system. So I think even the government is starting to look at, we need to see how things are going. The programs implemented in schools, how is that going into secondary education? How is that going into the workforce? That this might be a method to actually see what we're doing and track the individuals. I guess I feel like I'm going kind of fast. I don't know. I'm not really sure if there are questions or
if you have, you just tell them that if they have questions, they can ask them or
yes, feel free to type a question or ask a question if you have any. So this is kind of basically a representation of the information that we have, and so these are different systems that we have. And from these systems, we actually get the identifiers so we can link people. So for instance, from Vital Records, we get the birth and the death certificate. Department of Alcohol and Drug Abuse Services, we get their claims information on their patients, the same with the Department of Mental Health. Now, these are obviously majority state agencies, so they're going to be focused on, if you go to a private mental health provider or if you go to a private alcohol and drug clinic or something like that, this will not be reflected here unless it's paid for by Medicaid services, Medicaid claims, or if it's a state health plan for state employees. We do receive all of the hospital data, and that is mandated that we get all inpatient, outpatient, emergency department, hospitalization data. So that is regardless of your payer, whether it's private pay or self-pay, we get all the claims. So there's that allows for a lot of research and looking at things, especially if you're studying health outcomes and things like that. A lot of times, a lot of interest is, are things being done to make sure people aren't, constantly going back to an emergency room and things like that. So that can definitely be done with the hospital data. Again, we do get the Medicaid services data and the state health plan. That information is not only the hospitalizations, but also their private visits too. So if they are going to a private provider that Medicaid pays, then we would have those claims as well. And that allows you to get a more complete picture, because if someone is managing their asthma or diabetes, hopefully you wouldn't find them in the emergency room or in an inpatient setting with those issues. So it kind of allows for if you're doing a more in-depth health study. Now, from the Department of Social Services, we get quite a bit of information. We do get the child care voucher data. So those children that receive the ABC vouchers from Department of Social Services, we do get that data. We also get their human services, which would be child protective services, adult protective services, and foster care. And then we also get the more economic services as TANF, which is temporary and assistance for needy families, and SNAP, supplemental nutrition program. I can't remember what the A is. So that kind of covers, again, you're dealing with a probably more poverty-based cohort there, but I mean, if Department of Social Services involved, we have most of that information. Kind of going up that side, we also have some criminal justice information. We get the Department of Corrections data, which would be, I guess, anyone that is housed in a facility. I say housed, I guess, as a prisoner in a facility, like it's an option, but is a prisoner in the State Department of Corrections. So we do not get like the local county jails and things like that. Not that, but it would be those that are controlled by the State Department of Corrections. Juvenile Justice is the Department of Juvenile Justice, and that covers not only those offenders that end up being housed behind the fence, but a lot of them that stay in the community and receive other types of services so that they can stay at home. And SLED is our criminal history data. That's all the arrests for the adults, and those data go back. SLED goes back pretty far. Department of Disabilities and Special Needs, we get their clients. We do get some employment and wage data from the Department of Employment and Workforce. We do have a caveat with them at this point. We're hoping to kind of change that, but that information we can only release at the aggregate level. And so we do get requests where we will do provide a data set that's at the person level, but you get all the identifiers are stripped off, but you might want to link hospital data to DSS data to SLED data. So you would get those different data linked across for the person. For the employment and wage data, that information can only kind of be released where it's aggregated, maybe at a county level, some kind of geographic level, or maybe if it's demographics or something like that. So at this point, we're trying to work to see if we can kind of do something else, but it does allow us that if we do the analysis, we can supply you with that data. And we do get some of the employment and training programs that has kind of ebbed and flowed a little bit, where we've gotten information and then we've had a little bit of a break. And so and then the unemployment claims is also like the employment and wage that's only released at the aggregate. Department of Education, they do a 45, 90, 180, no, 45, 90, and a 135-day census of each school. And so we get the 45 and the 135-day census, where basically at that point in time, what kids are in what school. And so we get the information on them, their basic demographics, what grade they're in. There is some disability codes and some information like that. And then we also get their standardized testing data. So those are your pass and PACT scores and things like that. So that does give us some outcome information. School, like your average classroom grades, are not currently things that it's been very difficult to try to figure out a way to make that the same across the entire state, because we have so many different school districts that, you know, they kind of have their own little rules and things that are different. So it's a little bit hard to make that consistent across the state. So we don't actually have individual course grades. And then this last program is the state First Steps Office, which is a program for children that's more of your pre-K kind of group, and it kind of helps prepare them for school and prepare them for learning to read and things like that. And so those systems, those are data agencies that submit data that we get. Some we get annually. The SLED data is kind of more of an annual. Some things we get Medicaid claims data. I think we're getting that monthly, but the enrollment into Medicaid, just the recipient file, we're getting daily.
Oh, wow. And what's the lag time So,
Well, because there's other projects that we kind of work with Medicaid that look at does their long-term care. So they have staff that go out into the field that see their like home care. So they have to have that information pretty up to date. So, but to match with the claims, I mean, if you're actually doing analysis, the claims can, because it kind of depends on the physician actually submitting the claim.
Okay.
So, you know, if you have a physician who's, you know, it's the same with, you know, hospital and state health plan. If it takes them a couple of weeks to submit the claim, it's not going to get processed because these are the actual paid claims. So this isn't, you're not going to get like your lab results and the stuff that you would find in the medical record, but you would know the diagnosis, procedures, and things like that that were done. Medicaid and sampling, you also have pharmacy data as well as your office visit data. And so then again, our tracking system, so we basically create our own unique identifier using kind of a series of algorithms that takes the identifiers that we get and kind of assigns this unique identifier to them that is kept in our office. And that's how we link across the systems. So when we get a file in from Medicaid, it gets processed through and our linker is put on there. And the same thing with DSS. So when we have that, then we can link the people that are in Medicaid to DSS, to the Department of Education, to criminal justice, to disability and special needs. We can link them across all these systems using that. And so it would be nice if we had just one application, but because of the different types of data and the different regulations that govern the data. So for hospital and Medicaid, you have HIPAA, and then for education, you have FERPA, and then for law enforcement, you have some FBI regulations. So they all kind of have their own application process. We tried to make them as similar as possible. So a lot of times you can just kind of cut and paste from section to section and to make it easier, but you kind of figure out what information you would need and you would complete an application for those agencies, and then those would be reviewed and you know, hopefully approved, and then we can begin kind of doing either providing you with a data set, or if you needed us to do the analysis, and we provide you with a report and whatever information that you would need. And so that tracking system allows us to see people, to kind of to track them across time, to kind of see if you know, especially if you're doing something where there's an intervention, it's definitely a way to kind of see if what's happening is making a difference. So if you have a cohort of people that we're going to track across time, that's also a possibility. We have situations where people will send us a file of the individuals that are a part of their program, and we will track them, looking at their health outcomes or social services or whatever information that they're interested in, what they're trying to affect. So what, I guess, our products, you would say, I mean, the big, for my side that I can speak to is mainly these analytic products, the, you know, agency collaboration, researcher collaboration, you know, linking the data, de-identified data sets and things like that. That's kind of, I guess, my realm in our office, that, you know, if you're wanting to get this data and to do some kind of linkage project, you would contact me and I would kind of walk you through the process of, you know, what kind of information are you looking for, you know, making sure that we kind of really hone our requests so that it will lend it to being approved and not too broad that it might scare an agency to release. And so I would kind of help walk you through that process so that you can get what you need. We also have a development section in our office that has done actual development of applications and products. So what I was referencing before, the community long-term care application, it's a system for the caseworkers that go out into the field and deal with those long-term care recipients of those services. So they can kind of go in, they can record their information as far as, you know, vitals, what kind of medication, and if there's any kind of questionnaires or any kind of things that they need to complete, they can kind of go through and do that. And these are all those type of products that we've worked on with other agencies or other entities to kind of build for them so that they can kind of track their clients, how they want to do so. And so that's more of kind of a web development kind of piece. And then that, I mean, this last slide is just who I am. So if there's any questions, I'd be happy to answer.
So they might be, you all might be thinking of questions. I'm going to go ahead and ask one while you're thinking of your questions or typing them in. What would be an example maybe of a project that you could describe for us, like an application, and kind of what's the time frame for that?
Okay.
And, can you walk us through like a real project?
Right. So if it kind of, the time frame can depend on the complexity.
Right.
So like, if because I guess also with the analytical tools, one of the things we do is we actually create something called a data cube, where we can kind of feed the data in and allow you to kind of slice and dice it on your own. And that can be time consuming, but for a basic research request, depending on the number of fields, I would say 2 to 4 weeks once we receive the approvals.
Okay.
Approval for the data oversight committee, which they are in control of all the hospital data, they have set meetings.
Right.
It's kind of an open committee. That's a quarterly meeting. We have had situations where we've gotten a lot of applications in and have said, okay, can we go ahead and have it? And we've had like a supplementary meeting, but typically that's a quarterly meeting where we meet and we go over the application. Some kind of work by committee where there's an actual committee, and some of them work where I kind of submit them to someone and they kind of route it through their system. So if it's a very straightforward request where it's not, you're not trying to ask for everything, you're saying, okay, I'm interested in looking at people with asthma, Medicaid patients with asthma, and I want to see if they're coming back to the emergency room. And then I'm also thinking I want to see how their school information is looking. How's that looking? So with the education data, because of course it's not like a real time thing, you're probably going to have to you're not going to be looking at the people who went to the doctor 3 months ago. You're going to be looking at maybe the previous school year. So that would be an application to Medicaid and Department of Education. And we've been working on our applications. So the Medicaid application now actually is kind of like check boxes. You can say, okay, I want this field and I want this field, and we're trying to do that with more of them. But it takes time to kind of go through and try to figure out what do people ask for that we can kind of make as a checkbox. So, and that is, we usually have Medicaid meetings every other month. And Department of Education, if it's data that we actually have, some information that we don't normally get, but Department of Education may be willing to still supply for a request. It can be a request to them to do a special submission, send it. But if we have it, I would say education, it's usually like maybe a couple weeks to get it reviewed. 2 to 4, depending on kind of the last batch. And it sometimes depends on the time of year too, because if you get them like right at the end of the school year when things are kind of, they have a lot of deliverables and they may be focused, especially if it's getting close to testing time, which is usually the spring. So that, but I mean, for us to do the data is there. So a lot of times, I mean, especially if we're just creating a data set with maybe some flags and stuff like that, a couple of weeks to turn that around. But depending on the complexity of the project, approvals tend to be what takes the most time, because the agencies have to review and they have to feel comfortable that their clients are not able to be identified. So that's one of the reasons why we try to kind of get people to really focus their request in what they need, because a lot of times you see all this information and it would be so great to have it all, but it's not, I mean, you don't need it all. And it doesn't preclude you from, asking one request and getting some information and kind of going, oh, wow, I learned from this, and then submitting, a couple years later or a year later, submitting another request because you want to further explore something else. So, I mean, it's the more straightforward and direct the application is, the quicker the approvals go.
So can you give us an example of one?
Okay. Well, I guess I mean we do a lot of work with Dave Murday, and
Right.
so
Yeah, no,
we've
I'm
done.
sure you'd be
There's
fine to share one of those
so
examples.
one of the things they're doing, there's a grant for youth suicide prevention,
Right.
and that one has been a little bit. I mean, so what we're looking at is suicide completions and suicide attempts in the hospital data, and we're trying to look back and see where could we have found these people. So were they in Department of Mental Health? Did they come to the Department of Alcohol and Other Drug Abuse Services? Did we see them in the ER looking out 6 months prior to the attempt or the completion, a year prior? Where could we maybe put an intervention is what I think their goal is.
Right.
Our information is okay, so we kind of can pull the information from the DHEC vital records data. We can find the suicide from the death certificate.
Right. If it's listed.
If it's listed, I mean, you always have those caveats that if it's not coded correctly on the death certificate, that you have that. And the same thing with the emergency department. Was this person was it an accidental overdose or was it an intentional overdose? And so you have to, I mean, there are always those caveats with the data.
Right.
So I mean, that's one thing you have is that what you get is, I mean, what's put in is what you get. So if it's just, coded as an accidental overdose, then that's not going to be found as a suicide. Right. But then if you have something where they might have suicidal ideation or a coding for attempted suicide, then we can take that information and we can link. We have the individual, we have our linker on there, so then we can look and see, well, how many of these people were in the Department of Mental Health? They went and had a mental health service within 6 months of that event, or had an alcohol and drug abuse service within 6 months, because their goal is to figure out as many ways to make an intervention. Right. So we even link to corrections data and things like that, and SLED data. Did someone have an arrest? Did someone have where are the places to put people so that we can have an intervention? Right. And so that's kind of one of the projects that we've done.
So you looked at they can't hear me better.
Okay.
So you looked at, once you had the ID for somebody who had completed suicide or attempted, then you looked in all these other systems.
Right. So then we linked to all the other systems to find out what else we knew about them.
Yeah.
To find out if there was there information on them. Did they go into Department of Mental Health? If they did go into Department of Mental Health, what kind of diagnosis did they have?
Right.
And they kind of had some where they coded with any of these diagnoses and things like that, and how frequently did they have services, and same with alcohol and drug abuse services and things like that, to kind of see, and for that kind of helps them to see if, I mean, unfortunately, they found that a lot of the people, we're not saying, you might see them in the emergency department, though maybe they had an accident, 6 months before. So it was looking in different systems to see if there's other ways that we can kind of track these individuals and find these individuals.
And I think one of the ways that is through pretrial intervention.
Yeah.
Because I went to a presentation from another program, master's.
Yeah.
And it was a pretrial intervention.
Yeah.
Like where some of these folks might be.
And then you have like first steps. One of the things they're mandated to do is to evaluate their programs. So they're pre-K. So what we do is we take the cohorts here, and now we're tracking them forward. And so we kind of, okay, so these kids back here, how are they doing in standardized tests? They're, I mean, the Department of Education, there has been now a kindergarten readiness test that has been implemented this past school year. And they hadn't been doing that before. There was a readiness years and years ago, and then they didn't do it anymore. So, I mean, now we're kind of hoping to get more information on that. So then that would allow us to kind of look at these people and kind of say, okay, you were in this First Steps program. What was your readiness score? And as they go, do we see them? How's attendance? How are they doing in the third grade readiness or standardized test, and so on? So it's kind of being able to track people forward. The longitudinal system that they've had for that they was introduced as a new bill just this past legislative cycle is kind of what they're trying to see is the people who are coming out of our high schools and things like that here, where are they going next? So are they going, so can we get some, now of course we can only do it within the state. So if they leave the state, we unfortunately can't track them there, but we can look at them as far as, are they going into higher ed? Are they going into just the workforce? Where are they going from there? And the hope is to be kind of be able to track. And this is something that's also kind of an interest of the Department of Commerce and the Department of Workforce, because in trying to promote businesses to come to the state, you want to be able to say, we have a workforce for you, that we do have people here that can do the job that you need. I mean, Volvo's coming, okay, we do have people in that area that have that, you know, those type of certifications and things. It's going to take probably some additional information coming from the agencies that may need to start collecting that they haven't. But I think they're trying to make that one, because having that information does make South Carolina a little more marketable to those industries, to be able to talk about, this is your workforce, this is where, and not only that, but this is where you're going, you know, this is what's in the community around, this is what the health kind of looks like, this is things like that.
So, but do the state universities give you data?
No, that's one of the things we're working on, that they're trying to work on is the state universities and the state technical colleges to, and one thing is they now have things where they have to report back to the schools and things like that, certain information. So the thought may be is if we can kind of get this might streamline that process a little bit. So, you know, we're kind of hoping that maybe with all the things that people are now demanding of them, that it might be, maybe this is the easier route.